Are you a healthcare professional looking for a trusted concussion resource? Then you've come to the right place. From her New York City studios, welcome to Concussion Corner with your host, Dr. Jessica Schwartz.
What if the greatest risk to your patient isn't doing too much, but nothing at all? In this episode of Concussion Corner, I'm joined by Dr. Jeff Moore, CEO of the Institute of Clinical Excellence and founding partner of Onward Physical Therapy, to unpack what it means to practice at top of scope. We dive deep into the risk of rest and concussion, pregnancy, chronic pain, and aging, the power of psychologically informed physical therapy, how fitness-forward rehab models are transforming care today in 2025, and why Institute of Clinical Excellence and Onward Physical Therapy are setting a new standard for patient outcomes and sustaining clinician sustainability. Whether you treat concussion, pelvic health, low back pain, or older adults, if you want to deliver care with clarity, compassion, and clinical confidence, this episode is for you. My name is Dr. Jessica Schwartz. I'm a physical therapist, brain injury survivor, and founder of Concussion Corner, and I'm so happy that you're here. Let's begin. Welcome back to the Concussion Corner Podcast, Jeff.
Jess, so stoked to be here.
I am so happy to have you back. I haven't seen you in a few years. Last time I saw you, we were eating our way through the East and West Village in New York City, and that was definitely a memory for sure.
Yes, that was an awesome night. I got to get back out there. We chatted about the U.S. Open, even maybe watching some tennis. I've got to get back out that way ASAP.
Oh, fantastic. Are you still fasting? We should let the listeners know. I think that's important.
For sure. So intermittent fasting, normally starting my eating around 11 o'clock in the morning, but also we're now doing a fasting group. So one day a month, we start on Sunday and we fast for 36 hours. There's some pretty good research out there on senescent cells and zombie cells, and the ability to clean that up if you fast once a month. So we've got a group and we do it.
Fantastic. Yeah. Just for our listeners, when I saw Jeff last, he probably ate thousands of calories just at nighttime. And I was so in awe. And I was just so happy that he was happy to have all the pizza and the meats and all the things. So anyway, so let's get this thing started. Cool. It's so great to have you back. I'm so proud of what you're doing for the physical therapy profession, for fitness forward physical therapy in general. And really just moving the needle forward in really what needs to happen in 2025 for really all things healthcare. I'm not going to just lock this into physical therapy. We've been caring for the sick. When you have something happen, you go to the specialist. But what you're doing is it gives me goosebumps. So I would love for you to let folks know what you're doing with ICE physical therapy and then how that kind of transitioned into Onward physical therapy. And I would just love all our listeners to know in 60 plus countries and all the states in here in North America, at least in the US, and just take it away.
Sure, you bet. And first of all, thanks for all you do, especially in the concussion space, which is underserved and I think sometimes underaware how much we can do in that area. And having your voice, Jess, has been just instrumental for our profession. So thank you. ICE Physio really started growing. For those who are totally unfamiliar with what we're up to, the Institute of Clinical Excellence, known as ICE Physio, is a continuing education company. And we started it in 2012 and, slowly driving the truck around Michigan and Wisconsin doing courses and, slowly building traction. But then 2016, 2017, things really took off. And Jess, there were ups and downs to that process. And it was very exciting to see the growth. But it was also very frustrating, meaning that we would get a lot of clinicians reaching out saying, Jeff, I love these classes. I've never been more excited, yada, yada, yada. But I can't do any of this stuff in my clinic. My clinic doesn't have a squat rack. They won't buy a run of kettlebells. So it was almost worse than not teaching them in the first place, right? So here we're so excited about fitness for physical therapy, but if you can't actually do it, there's really no progress being made here. And so we kind of looked at each other in 2019 and said, you know what? Let's just start building our own clinics. And let's build them with the equipment that when someone goes through ICE Physio courses and really begins to adopt this fitness forward mindset, they have a perfect spot where they can execute that kind of a model. And so in 2019, we opened the first Onward Physical Therapy in Charlotte. And since then, we've grown at, a clinic every couple of months. We've got 42 locations, coast to coast. Literally, Bellingham, Washington to Cranford, New Jersey, coast to coast, everywhere in between, 100% out of network. So we contract with no insurance companies whatsoever, that Medicare, Medicaid, any of your commercial payers. It truly is a 100% out of network practice model. And it's very fitness forward. It's built off the ICE curriculum. And we are just kind of slowly and steadily building, Jess. And I think the sky's the limit.
No, fantastic. And, if you can just highlight maybe the top 3 courses that you guys have at ICE Physio, because I think it's important to know, like, hey, you were dangling the carrot. And as you can tell already for our listeners, that Jeff has incredible energy as well as all the faculty that he works with over at ICE Physio. But again, you're kind of dangling the carrot, getting people psyched and amped, and then they couldn't perform in their clinics because they were restricted. So what are some of the top 3, maybe 3 to 5 courses that you're running over at ICE?
So what's cool, Jess, nowadays, we've really kind of changed the way we offer a curriculum in that we don't think so much about it as individual courses. Not that you couldn't just jump into a lumbar spine course or a pelvic course or an endurance athlete course. You totally can. But we tend to feel like packaging them in certification specialty tracks is the best ROI for the customer. So nowadays we think more about it by division. So like, for example, if you are a new grad and you're like, I really want to specialize in pelvic, right? That's who I want to see. It's who I want to over deliver for. I've identified why I want to work for them. And now I just need the skills. We're going to encourage you not just to jump into a pelvic course, but do the pelvic certification. And that's going to be a level 1 and level 2 online course and an in-person course where you're actually going over all the hands-on, the psychomotor stuff. In that sort of model is true for all the areas of ICE Physio. So we're trying to develop specialists in these different areas, be it pelvic, older adult, endurance athlete, fitness athlete, spine care, whatever population you've identified, we have a multi-course series to run you through online and live courses to get to where you're like, I feel I can really crush this population in my community. So that's kind of how the curriculum's organized nowadays.
You just mentioned pelvic health, so I just want to connect to that. We just had actually Dr. Ann Duke on a couple weeks prior. Yeah, so we have a 2-part series with her, and we kind of all stem from our sports neurologist that's on our faculty at Concussion Corner Academy, talking about return to intimacy, actually in our live Q&A. We talk about return to sport, return to learn, return to academic settings, return to all the things. And all of a sudden, no one's talking about return to intimacy. So, it kind of came up and we brought in Anne, who has, over 100,000 followers on Instagram, and she's crushing it. But what's the difference between something that the pelvic health education that you're doing at ICE, Institute of Clinical Excellence, what's the difference between that, the women's clinical, the WCS, the board certification with APTA, and then something like all the other pelvic certifications that I know they're doing like massive, like 1, 2, and 3-step internal examination and thing like that. What's the difference between what you're doing and the others?
Very cool. And I don't want to speak out of turn as though I know those programs really well, because I don't. I've never taken those courses. I'm sure that there's a ton of quality out there from a lot of different programs. What I can tell you that we really focus on at ICE Physio, if you're going to go into the pelvic space with us, probably the biggest thing you're going to notice is the fitness forward component, right? So we are going to be talking a lot about returning to exercise, whether it's marathon running and working on impact and leaking in that space, or whether it's Olympic weightlifting, barbell training, CrossFit kind of stuff. Like, our faculty is very, very driven around helping women during pregnancy and afterwards be where they want to be psychologically and physically, right? So there's, as you know, some really unfortunate common wisdoms out there in the pregnancy and postpartum space, right? Like, do nothing for 6 weeks, then return to everything. Like, just totally bonkers advice. Don't lift 20 pounds for some arbitrary reason because someone said it 50 years ago. Our faculty is really pushing against that, where looking at your individualized training age and what you do and what you're comfortable with, and maintaining that, even heavy lifting through pregnancy. Christina Previtt doing some incredible research and showing that that stuff is looking pretty darn safe, maybe even protective in some ways. So like, really pushing the narrative on the fitness forward spot. I would think if you took a broad series of courses, that's what would jump out to you as being really different, unique in the ICE Physio curriculum.
Yeah, and I think it crosses over with concussion, right? So you're in that space of the lumbar spine. You have true expertise in manual therapy. Jeff is one of the best to do it. I'll bump him up here on the podcast. And so if we're looking at low back pain, which we know is such a polarizing topic in all of medicine, from chronic pain to just everything between manual therapy, exercise, and so on. Then you're looking at pelvic health. And then you're also, now let's talk about concussion. All of those can, in absence of evidence, what do? We tell people to rest. We either allude that it's in their head and that they're malingering or faking it, because that's where some of the third-party payer and legalese or legal language has led to, or we just, allude that they're faking and malingering. But again, for me, with concussion, we have comprehensive targeted physical examinations now that can identify what's going on with the patient and validate the patient symptom profile. So how did you kind of lean into all of these areas that you want to kind of lean into? Because I know that we've had this conversation in the past We kind of came up through some of the same pathways in our career, and really talking about top of scope, really helping those people at that top 1% of our doctor of physical therapy here in the US.
I mean, the big thing for us, the big driver, I think, Jess, like the impetus for all of it is that nobody seemed to be talking about the side effects of rest. Like, you're right. That's the default recommendation. Hey, if we don't know what to do, do nothing. Okay, doing nothing has some profound negative side effects, like especially when you look into the older adult population and you look at sarcopenia and frailty, like, man, people resting is disastrous. And so I think a big driver for us was like, whether it's someone who is going through a pregnancy or recovering from that or an injury or someone who's an older adult, we have to, unless we absolutely must, we have to avoid rest. And so I think that has been a driver, Jess, for our entire curriculum. Like, whether it is someone who's a really high level runner and experiencing an injury or a stress fracture, and we're like, what can we do besides rest? And to me, that like motivation to not have people lose what they love and lose their conditioning they've earned, their fitness they've earned, and their longevity possibilities, I think the driver to avoid rest in every single one of these divisions has been huge and has really made us challenge the research and do some research and just really push that narrative that that should be a last resort, not a first decision.
Yeah, and we see it also in concussion. So we see it, and we just had Dr. Julia Trelevan on, one of the world's leader in the cervical spine, if you're in Australia. And we were just talking about that combination of manual therapy and exercise and why that's so important, because there's really been this polarizing effect in the manual therapy, physical therapy world with people just really crapping on manual therapy. And that's what makes us so valuable, because we're not personal trainers. We have a doctorate of physical therapy. We can differential diagnosis. We understand how the pathoanatomical pathways work, as well as mind-body connection. We've all worked with that therapeutic neuroscience education over the years in our education. And, at the end of the day, we used to tell MS patients, multiple sclerosis patients, not to move, not to exercise. We understand that does harm. We said the same thing for our pregnancy patients: bed rest, bed rest, bed rest. And the same thing. We just turned 100 in 2021 as a profession, as physical therapists. We used to be rehabilitation aides in World War I. And literally, we were moving traumatic brain injury patients in the trenches of World War I as rehabilitation aides. So we know movement is safe and healthy, and we actually do harm. And we have evidence on our side, Jeff, for concussion, that 48 to 72 hours relative rest. We do know that you can do harm. And this is why I want to make sure we talk to folks in your realm in this fitness forward space, that we can do harm by doing these type 2 Valsalva-y aggressive exercise over 55 to 70% heart rate max with brain injury in the acute stage. But that's not an absence of moving. And that's why we have dosing of 55 to 65% up to 70% in that acute phase of concussion on a return to play protocol. So we get people back to moving safely. What are you seeing in terms of the lumbar spine, back pain space, even pregnancy space? What are you seeing in your world in terms of evidence, in terms of for movement, and really anti-bed rest?
Yeah. Well, first of all, I'm so glad your listeners just heard what you just said, because that's the nuanced level of expertise we're talking about, right? Like that, if you talk about top of scope and operating in that space, that ability to say, yes, certain kinds of activity can be harmful. If you've got somebody with a stress fracture and they are running, this needs to be a non-weight bearing scenario. But does that mean they can't be on the arm bike? Does it mean they can't be doing intervals? Does it mean they can't be pushing towards a new PR in an upper body movement that they've been struggling with and get coaching on it and wind up more fit after their injury and train? It's about understanding what you can and can't do versus doing nothing. Doing that, that's the difference. You being able to say, no, we can't have them up at 75%, but we can have them down at 50 or 55%. In fact, there might be benefits there. Just same story on our side. Whether you're looking at something like a stress fracture where you've really got to be quite pulled back, or you're looking at something like a pregnancy where it's more about doing a really good subjective and understanding what is this person's training history. What have they done up until now? Not everybody shows up to a thing like pregnancy the same. And so you've got to look at those subjective variables and say, what is very likely appropriate? Because it's not going to be some default, don't lift 20 pounds. It's going to be, what has that person been doing in playing right in that gray area to maximize their fitness, even if you have to manage some symptoms along the way.
In absence of evidence. And so many people are locked into this old work. We're actually going to be interviewing Steve Broglio, who's the president of the Concussion Sport Group. And actually, it's phenomenal to see, because his work was the 7 to 10 day return to play concussion paperwork for the NCAA in 2003. He debunked his own work just a few years ago, saying, hey, on average, our students, athletes who are top of scope in their field, right? Division 1 to Division 3 athletes, and our cadets, servicemen, and midshipsmen for the DoD, Department of Defense, taking on average 28 days to get back. And so what does that mean? So just the fact that we're able to debunk our own research, which is what research is all about, the scientific method. Just thinking back to that Steve Brolio and Mike McRae paperwork, we're coming full circle. So with the concussion patient, when they often are injured, I say as a brain injury survivor myself, that the injury is an injury of I am. It's who you are. So I am a physical therapist, I am a partner, I am funny, I am doctor, I am surgeon, I am wife, husband, whatever it is. And concussion really challenges all of those things. We see that on the chronic pain space as well with your folks with, chronic pain, lumbar spine, back pain, even pregnancy, postpartum issues. In terms of what are you seeing that your students are coming out of from your courses? Because again, they're going to catch on to all your guys' energy. What are really the big movement markers that are really making a difference in your educational, givings?
Yeah, when they come out, and what I'm most proud of, and a lot of folks that have come through any of our certifications or spent time in our coursework curriculum or working in one of our clinics, they really embody this idea that we are here to manage symptoms while we maximize fitness. This idea of don't lose the gym, use the gym, right? Like always avoiding rest and always finding ways, because a lot of times people are afraid to move, or they've got sharp pain flying down their leg, right? Like nobody in their right mind is going to be doing deadlifts if they've got 9 out of 10 nerve pain shooting down the backside of their leg. I mean, they're scared about it. It's massively unpleasant. But if you can look at it as, I'm not going to tell this person to stop. I am going to manage their symptoms, do whatever we can manual therapy wise, needling wise, decompression wise, get that area some blood flow and movement. It's all going to be analgesic. Get them from a 9 to a 4. And then be really creative about how you modify that movement to keep them getting a stimulus similar to it. Maybe we're going single leg. Maybe we're going RDLs. We're doing things that mimic the movement. After we've managed some symptoms, where all of a sudden they're like, dude, I pretty much got what I would have gotten if I was uninjured. That's what I want all the clinicians that come through ICE Physio, that work at Onward, to be able to do every day for whatever their specialty might be it the pelvic space, older adult space, fitness athlete space. Having the ability to manage symptoms so that you can maximize fitness, so that people don't lose the gym, they can use the gym. Those are kind of the things that our students really come away with.
And now, a word from our sponsor. Did you know that sport helmets are rated on a 5-star system similar to cars? And the safest helmets have nothing to do with price, brand, or availability? Since 2011, Virginia Tech researchers have been providing unbiased helmet ratings that allow consumers to make informed decisions when purchasing helmets. The helmet ratings are the culmination of over a decade of research identifying which helmets best reduce concussion risk. This work is done as part of Virginia Tech's service mission and is 100% independent of any funding or influence from helmet manufacturers. Our mission at Concussion Corner is to expose you, the listener, to trusted spaces in the concussion arena that translate to clinic next day. Please visit the Virginia Tech Helmet Lab website in our show notes or at bit.ly/Virginia Tech Helmets and spread the word to aid in lowering concussion risk in your community. Thank you for tuning in, and let's begin the show. Yeah, it's fantastic. And you talked about kinesiophobia, right? The fear of movement. And we also have that on our side. We have cognophobia. So people are afraid to think. And that was a term formed by Grant Iverson over at MGH Harvard. And, just being able to learn, for example, at ICE Physio, Institute of Clinical Excellence, and we do the same thing at Concussion Corner Academy. We really create psychologically safe learning environments, because I don't know about you, but my DPT in residency, some of it was pretty intense. And you go home kind of sweating and you're like, do I want to come back tomorrow? So, for me, I think postdoctorally, we want to make sure that we're really encouraging people to be able to elevate their own clinical practice, but that again transfers over to the clinician-patient relationship and really just helps build that therapeutic alliance, helps elevate care, and just helps people make them feel better. Because on average, when folks see me, they're seeing 6 to 7 providers before they get to me. And that means they've already been mismanaged potentially by more than half of them, if not all of them. So it's just lovely to see you guys, being able to have these conversations and, just talk about, hey, if there's a flare up, that's not a damage situation. And we have the same conversation with concussion patients. It's like, hey, you know what? I am so sorry for your experience. Acknowledge the experience, because we see it all the time where it's just poo-pooed and pushed aside, or, oh, like, doing pencil push-ups, that can't be so, you can't be so symptomatic from, doing 10 pencil push-ups. Well, absolutely you can, because 2/3 of your brain's pathways are toward division, and you have a visual-vestibular issue, and you just had to drive 45 minutes in traffic to get to me. So absolutely, let's acknowledge that symptom profile that's in front of us that we actually may have caused as a doctoring profession, as a clinical doctorate profession. Just really cool to see, 360. As we wrap up this episode, I just want to cover Onward physical therapy and what that is. And then we're going to talk about top of scope and what that means for the profession moving forward in part 2 of this series. But I love this quote from you on your website. It says, "We don't treat every condition, but we treat specific conditions exceptionally well." And we just had a conversation with Dr. Ann Duke again, who is again one of the premier pelvic health physical therapists in the world. And this is going to make some people feel comfortable and sweat a little bit. And I want to make sure we have this conversation because it's so necessary to have. She says, "I love CrossFit gyms, but CrossFit people don't come at me. But there are some physical therapy clinics that are setting up in CrossFit gyms seeking public health. There's big, loud clanking going on and big, loud, fun music." She's like, "I want fun music, but when I'm ready to have fun music and go to the club, we want to talk about," she's working with chronic pain patients, potentially intimate partner violence, potentially, sexual assault, things like that. Folks that are transitioning in care from male to female, female to male. So those gyms may not be, or clinics may not be appropriate. Tell me how Onward Physical Therapy is different and how you set up your clinics to make sure you're making inclusivity space for all, whether it be an acute concussion or acute low back pain or a pelvic health situation, and how that's being set up for success at Onward.
That's such a great question, because it's such a pressing kind of front of mind decision for a lot of people right now that are starting their practice. Where do I put it and why? We have really planted the flag that our clinics are going to be autonomous, independent, standalone, right? That is not because we love CrossFit. We love High Rocks. We are drawn towards high intensity activity as a group. We find it fun, engaging, personally, professionally, the whole 9 yards. But like you were saying earlier, you don't know how any individual patient's going to show up. You don't know if they saw 6 other people, had to drive across town, are really overstimulated, what have you, whether it's concussion, chronic pain, whatever it is. When that person comes in, you need to be able to manage their entire environment. If you're going to give them a perfect experience, you need to have control of all the things. How many times have we turned down some lights for a migraine patient? How many times, as you're learning about them in real time, you're trying to craft this perfect experience so they can heal and then thrive? We don't think that's possible when we're in somebody else's setting that is really always in kind of one gear. Again, a gear we love, but not always where everybody needs to be met. So we're always in gyms, Jess. We're doing injury screens. We're doing workshops. We do a lot of stuff in gyms. But the actual one-on-one care that people are seeking us out to receive at the absolute highest level we can provide it, that we remove ourselves from those environments so we can custom craft that experience. And that we feel pretty strongly that's important if we're going to meet the goals of everybody that walks into our doors.
Yeah, and I think at the end of the day, I've had a couple students come in through Concussion Corner Academy, and I just basically said to them, I was like, "Is your clinic conducive to healing for the acute concussion patient?" And the answer was definitely no. However, that doesn't mean in absence, we don't see those patients. When they're ready to come back to you, can you refer out to some place that has something like an Onward physical therapy, that has something like a private treatment rooms, that has something where they can be scheduled maybe at different times where it's a little less sensory involved, or there's maybe a sensory gym or something like that that can be more conducive to healing for chronic pain, acute concussion, et cetera, et cetera. So again, what you're doing is impressive because you are saying you can't treat all the things, but what you do is exceptionally well. And again, being able to differentially diagnose and then identify, hey, here's who I need to treat. So I can, me as a physio, you as a physician, an OT, a speech therapist, et cetera, how we can treat together. is just really fantastic to see. So I'm super pumped for what you're doing. I want to make sure that for next episode, we're going to kind of pull the tablecloth off of the table a little bit for the Thanksgiving meal.
Yep.
And let's get into top of scope, what that means for, physical therapists and even healthcare professionals all over the world, really, of how we can elevate what we're doing to treat the patients that we want to care for. And that's why we really signed up for this job, right? Is we want to be able to serve. So do you have any courses or anything coming up that you want to highlight that's going on for fourth quarter 2025 or first quarter 26?
We're pretty steady nowadays. We don't have a whole lot of ebbs and flows in what we do. We offer courses. We used to slow down in the summer. That day is long gone. So, as far as live and online courses, they run every 8 weeks. As far as the online stuff, the live courses, we've got sometimes 12 to 15 courses a weekend going on around the country. And outside of like the major holidays, that's pretty much true every weekend. So we encourage people whenever it works for their schedule, whenever they've got a moment where they feel they can really engage in a course and do a great job, we're going to be here ready, waiting to deliver for you.
Yeah, fantastic. I've learned so much from you as well, just kind of watching as an entrepreneur and as a new entrepreneur myself. And I've done the same. Is that for 2025, we actually just started opening up Concussion Corner Academy on a rolling admissions standpoint. And then folks can come in and meet our faculty live in the fall. It makes it easier on us, easier on our faculty, and then people can learn whenever they want. So I just thank you for that, because I learned that from you guys.
Totally. And that flexibility is huge from you all, because we're always pushing folks your way, because we don't offer specialized concussion education, and you all have crushed and cornered that market so well. And so the fact that it's even more convenient for folks who are sending your way is awesome.
Oh, thank you so much, Jeff. Well, listen, we're going to bring it back for part 2. Where can folks find you on social media for both Onward and for ICE?
Yeah, totally. So the easiest way to communicate with me is if you download the ICE Physio app. We all can message in there. And so that's just easier because it's off social media. It's a little bit easier communication. You're not relying on another platform. It's a free app. So you're always welcome to jump in there. Look at all the resources. We've got Fine and ICE trained PT, tons of resources, but also communication wise, if you just want to shoot me a message, that's probably the easiest. But Instagram is Jeff Moore DPT and email is jeffmooredpt@gmail.com. All of those work.
Fantastic. And yeah, we're following in your footsteps. We're trying to raise funding to kind of get there, but our next phase is actually going to be app-based, and it is. It's fantastic to take people out of the social media other realms, because if you don't own it, this stuff shuts down. You're SOL.
Best thing we've ever done as a company is moving over to the app too. And it keeps people, some folks have different, whether it's political beliefs or whatever, they don't want to be supporting different platforms, and they're entitled to that. And having a neutral platform where everybody can just go and it's designed for that and only for that, I think just creates kind of back to the safe space and feeling good about everything. One more version of that.
Fantastic. Well, listen, Jeff, it's always a pleasure. I'm going to see you for part 2, and thank you so much for coming on.
Can't wait. Thank you so much, Jess.
That's a wrap for part 1 with Dr. Jeff Moore. I hope today's conversation sparked something in you, whether it's rethinking the role of rest and recovery, elevating your clinical environment for psychological safety for both yourself and patient outcomes, or simply feeling re-energized about what's possible when we practice at the top of scope. If you're part of our Institute of Clinical Excellence Physio or Onward Physical Therapy community, welcome. You are seen and so supported here. We're offering a special discount code for you, and so just reach out directly to Jeff Moore or in the actual ICE Physio app for more. And if this episode resonated with you, please subscribe, rate, and share the Concussion Corner podcast with your community. Every listen helps us amplify compassionate interdisciplinary care around the world. And if you're ready to deepen your skills in concussion assessment, treatment, and recovery, we'd love to welcome you into our global community and our global learning family at Concussion Corner Academy. Our philosophy is super simple. Teach one, serve many. See you next week for part 2 with Dr. Jeff Moore, where we'll pull the tablecloth off the table and get into what top of scope care truly means for the future of physical therapy and patient outcomes. Once again, thank you so much for being a part of our Teach One, Serve Many community, and take care.
Thank you for listening to the Concussion Corner, hosted by Dr. Jessica Schwartz. The information in this podcast is for entertainment purposes only and not to be used as personal medical advice. Don't forget to follow us on social media on Facebook, Instagram, Twitter, and YouTube at Concussion Corner.